path that we are seeking to take through this pandemic.
Gordon MacDonald, to be followed by Faisal Chowdhury.
Long COVID has impacted around 80,000 people in Scotland and over 1 million people in the UK. This is a condition which can cause debilitating respiratory, cardiological and neurological symptoms. What consideration does the Scottish Government give to the risks of long COVID, especially its potential impact on the young, when it's reaching a decision about lifting of restrictions?
First Minister.
A central part, and has been a central part of our decision making in advance of today. Increasingly we hear a line of argument, and I understand the sentiments that drive this, I really do, that because COVID is now, mainly, not exclusively, but much more than was the case before, affecting younger people, and younger people are far less likely to end up in hospital or to be seriously ill or die, then we shouldn't bother about case numbers. Now, I do think because the link between cases and serious acute illness has weakened, we're not as driven only by case numbers as was the case previously. But long COVID is one of the reasons why we can't simply be unbothered, if that's the correct word or a word at all, unbothered about the level of cases, because we don't yet know the impact that COVID is going to have long term on some young people. Many people will have seen BBC Scotland's Lucy Adams report yesterday of her own experience with long COVID. It's horrific when you think about and listen to what that has done to people. So we have to be cautious, because every infection now could be a long COVID case in the future. Misery for the individual and huge pressure on our NHS. For how long, we don't yet know. So it's another reason for care and caution, and although it's frustrating for many of us, to continue to take a very gradual route through this, while of course, as others have said, rightly so, continuing to develop, understand and build the services that are going to be needed to deal with the implications of long COVID.
Faisal Chowdhury, to be followed by Audrey Nicholl.
Thank you very much. As more we have learned about the virus, the importance of good ventilation has been repeatedly emphasized. What work has been done in preparation of further restrictions easing to improve ventilation in public buildings and workplaces? Will the government consider regulating and inspecting ventilation standards, as for example is being done in schools in New York City, or will they consider imposing requirements for carbon dioxide levels as a measure of air quality to be publicly displayed in venues, including hospitality, as recently decided by the Belgian government?
First Minister.
It's an excellent question, and possibly in terms of the sort of environmental mitigations that we can bring to bear against COVID, one of the most important things we have to think about. So the short answer is yes. I've asked for some work to be done to look at how we much more radically improve ventilation in public buildings, but also make much more use of, for example, carbon dioxide monitors that are being used as a proxy measure for air quality that gives a certain level of assurance about whether a particular environment has the ventilation required to deal with COVID. There's also issues that healthcare workers will raise about, as we understand more about the airborne nature of transmission, about whether we continue to look at and develop approaches to appropriate PPE, for example. So the issues of ventilation and the implications of airborne transmission are increasingly a key part of our decision making here. I'll keep Parliament updated on our work on ventilation, but it is, of all the many good questions that have been asked today, it's possibly one of the most important in terms of how we do what everybody wants to do, learn to live with